Hello, everyone. Dr. Malescu, and I'm going to do a quick review of the endocrine system through a journal review on this topic in the National Library of Medicine. This is my favorite go-to for anything and everything academic, especially when it comes to anything in the health sciences. Now, some of you in my classes, whichever school I'm teaching for, we all have to do the APA format. So I am going to show you that because I get questioned all the time. Why didn't I get full points for whatever you describe in a discussion board or an assignment? Here's why, because it really is not that hard to get it now. It used to be that you had to type it all out and look things up. Well, now you can get the citation if you just start a free account with Grammarly. Here's my Grammarly. The other thing I wanted to show you is if you look at an article, which is this one here, if you click on the number here, the PMID number here, and you go here to cite, boom. Now you could do whatever format. For us, it's APA format, and you just copy that. And now you are golden. You are not at all plagiarizing. Whenever you do a discussion board or an assignment, at the end of your content, you put reference, and then there you have it cited correctly. The in-text citation, you should also put, you don't have to do it in quotes, you put in parentheses the author, and then if it's multiple, you don't need to list the whole thing, you put the author, and period, comma, and then you put et al, E-T, all right, al, A-L, period, comma, and then the year that it was published, okay? How do you know? Well, the year that it was published, since you did the reference, you know it's right in here. Copy and paste that, you're good, okay? So now back to the full text. I can read it off of here, but what I did was I downloaded the actual study and review of the endocrine system. So we're going to go over it this way. So if you have any questions, feel free to Canvas inbox me. This is the only way I like to communicate. Of course, if it's an emergency, you can text me as always. But email and number one priority. If you want me to respond to you right away, I'm online all the time with the Canvas courses, whichever classes that I teach across 3 schools. So please just Canvas inbox me. It'll alert me right away. Okay, so let's go over the endocrine system, shall we? So first of all, if we scroll down, you can read this on your own. I'm going to upload this PDF in your announcement section, as well as providing you the reference, APA format, and the link, of course, so you can go to the actual website, National Library of Medicine. For our purposes here, I'm going to do a quick micro-learning session, and endocrine system is super important for all of you that are going to become medical professionals in whatever capacity of nursing that you are going into, LPN, ASN, BSN, MSN, whatever. Okay, everyone needs to know endocrine system. So I'm going to go over the main glands that you need to understand. And then, of course, you're going to have to recall all the hypothalamic hormones, all the anterior pituitary hormones. There are 6 of them. Posterior pituitary hormones. There are 2 of them. Thyroid gland. Well, you have the thyroxine, the inactive version T3, because there's 3 iodines, T4, because there's 4, and that's the active version, thyroxine, which regulates your metabolism, plus another hormone that people forget, calcitonin, which regulates your calcium. If the calcium levels are high in the blood, calcitonin comes to the rescue. What it does is it inhibits the osteoclasts, which break down bone, and stimulates the osteoblasts to build bone. So therefore, any calcium that's in the blood will be mobilized and used up as calcium phosphate to the bone. by stimulation of those osteoblasts. In addition, the next one is the parathyroid gland that's located posterior to the thyroid gland. There are 4 little tiny glands there, and it does the exact opposite of what the thyroid gland calcitonin hormone does. So calcitonin is going to be released when the calcium levels in the blood are high, and then parathyroid gland releases parathyroid hormone when the calcium levels in the blood is quite low. So at that point, we stimulate the osteoclast to break down bone. And so therefore now we're mobilizing the calcium into the bloodstream and inhibits the building cells, right? So the bone building cells are the osteoblasts. So that's everything you need to know about the thyroid and the parathyroid gland. Notice I skipped over hypothalamus and pituitary because that is a whole lecture in itself. And I'm going to go back to it and give you all the details in about a New York minute. I just want to review and do a cursory review of all the hormones that you see here and the glands that are located throughout your body. Okay, so like I said, the hypothalamus has plenty of releasing hormones that we need to go over. 6 hormones from the anterior pituitary that we need to go over. 2 hormones that are from the posterior pituitary. I just finished going over thyroid gland and parathyroid gland. Now I'm going to go over the adrenal gland. The adrenal gland is going to sit on top, superior to the kidneys. What does the adrenal gland do? Well, it has 2 sections. The adrenal gland has the adrenal cortex, and the adrenal gland has the adrenal medulla. The cortex is the outer shell or the outermost aspect of the adrenal gland, and that releases a number of hormones. The corticosteroids, glucocorticoids, as I say, and of course the mineralocorticoids. So the glucocorticoids are all the cortisols that are released when there is chronic stress. So the cortisol levels, when they go up, the protein levels in the blood go up, the fat hyperlipidemia in the blood goes up. Everything goes to glucose, so we're converting, the liver converts a lot of the non-glucose sources such as fats and proteins into glucose, providing a hyperglycemic state. This is all for the fact that the body thinks that it's in chronic stress and it needs to retain all energy. And this is how we gain weight. This is how you get increased cholesterol in the blood, plaque formation, heart disease, diabetes, high blood pressure, all from the fact that cortisol is the chronic stress hormone, so stress does kill. In addition, the adrenal cortex releases aldosterone, which is going to cause the reabsorption of sodium, which then causes reabsorption of water instead of excreting it out. And so by doing that, we're raising the blood pressure because of the blood volume going up. So that's everything about the adrenal gland. Now, in addition, there's what's called the adrenal medulla. The adrenal medulla is going to release epinephrine and norepinephrine. These are the adrenergic processes that are acute stress, fight or flight. And it is pretty much controlled by what's perceived in the external environment. So the hypothalamus reacts and causes the nervous system to react. Fight or flight, sympathetic. We have adrenergic receptors and preganglionic and postganglionic nerve fibers. And the preganglionic are really close to the spinal cord that can react immediately and send the message. Eventually, the adrenal medulla is going to release epinephrine and norepinephrine. So this adrenaline is going to shut down your bodily functions or at least diminish it. So while you're in fight or flight, digestion goes down, urinary output goes down, and all blood flow is diverted to the cardiovascular system, where you're going to increase the heart rate, increase the blood pressure, increase the respiratory rate. Eyes will dilate, pupils, right, will dilate in response to the sympathetic nervous system. Your mouth gets dry, vasoconstriction basically of all the vessels. So that is what's happening with the adrenal medulla releasing epinephrine and norepinephrine. Now, the next one I'm going to go over is the pancreas. The pancreas has three kinds of receptors. It has the alpha, the beta, and the delta. So the alpha is going to release glucagon, and glucagon is basically the hormone of hunger. All right. So basically the hormone of hunger, it means that when your blood glucose levels are 50 or less, it could be even at 75, your pancreas starts secreting from the alpha receptors in the islets of Langerhans, the glucagon hormone. Glucagon hormone then is going to go to the liver. The liver will then break down the glycogen into free glucose that goes into the bloodstream and saves you from passing out, because glucose is much, much needed and crosses the blood-brain barrier. Your brain needs glucose to be completely active and alert. So that's the alpha receptor. Now the beta cells, I said receptor, I should say cell. The beta cells, the alpha cells, the beta cells, and the delta cells. I don't know why I said receptor, because I was still thinking and focused on the adrenal medulla with the adrenergic receptors. All right, so like I said, glucagon is going to be released by the alpha cells in the islets of Langerhans. Now I'm going to go over the beta cells in the islets of Langerhans. These are going to release insulin. These cells release insulin throughout your life. And if you have some kind of viral infection, there is an autoimmune reaction at some point post-virus, where in childhood, where sometimes the beta cells get destroyed, and this results in type 1 diabetes. Now, type 2 diabetes is the most common, and almost 50%, well, around between 40 and 50% of the population is pre-diabetic or diabetic type 2, due to the fact that we have sugar in every food. Fructose is hidden in everything. Anyway, I want to make the long story short. This is what causes this whole obesity and hyperglycemic state and diabetes, the insulin receptor insensitivity. So it's not that we don't have insulin, and insulin's still being secreted, but the cells are insensitive to the insulin. There are some insulin receptors that will shut down and no longer bind with the insulin. If that doesn't happen, it's like a lock and key. Insulin binds to the insulin receptor, lock and key, and that opens a channel, the door opens, and glucose comes across the cell membrane into the cell. Well, when you become insensitive to insulin, the receptors of the cells shut down, and the cells they get starved, they do not get glucose, and you remain in a hyperglycemic state, therefore spilling the glucose in the urine. You could smell it in your mouth, a fruity taste, you know, the typical hyperglycemia. Now, that's the beta cells. That's what happens in disease, type 1, type 2 diabetes. And then finally, delta, which is somatostatin, which stops growth hormone. All right. Now, the next one is the estrogen and progesterone hormones, and the testosterone in the testes. So let me tell you about that. the FSH and LH, which are two hormones released by the anterior pituitary of the pituitary gland, is going to have effect on both the ovaries and the testes. In the female, FSH, follicle stimulating hormone, is going to stimulate ovulation. LH is going to stimulate the release of estrogen, which gives the secondary sexual characteristics. In the male, FSH stimulates sperm production and LH stimulates testosterone. Okay, now I can go back to the hypothalamus. So the hypothalamus has what's called releasing hormones. So we have a growth hormone releasing hormone that is released by the hypothalamus that tells the anterior pituitary to release growth hormone. Growth hormone is released and moves into the bloodstream and causes growth of cells. What cells? Muscle, fat, bone. All right, so that was growth hormone releasing hormone. Then we have adrenocorticotropic releasing hormone, which then stimulates the anterior pituitary to release ACTH. ACTH is adrenocorticotropic hormone, ACTH, and that goes in the bloodstream, and ACTH will then cause the release of the glucocorticoids in the adrenal cortex. All right, so we went over growth hormone, ACTH, and now we go over the next one, which I'm going to mention in a second, prolactin. Prolactin is a hormone that is going to help only when you're breastfeeding. And of course, the hypothalamus has a releasing hormone. It has prolactin releasing hormone, which then stimulates the anterior pituitary to release prolactin. Prolactin then surges in the bloodstream, gets to the mammary glands of the breasts, and the mammary glands of the breast will release milk as long as the baby continues to nurse, to suckle on the nipple. Okay. Now, the initial letdown of milk is another story. I reserve that for the posterior pituitary and the hormone oxytocin. But first, I need to finish the anterior pituitary hormones. So circling back, what did we go over? We went over growth hormone. We went over ACTH, adrenocorticotropic hormone. We went over prolactin, okay? And we have the prolactin releasing hormone and prolactin releasing inhibiting hormone. That's a mouthful. So those are the hypothalamic hormones that regulate your prolactin. So if the baby stops nursing, then you have prolactin releasing inhibiting hormone, which inhibits prolactin, and therefore levels go down by negative feedback because the baby stopped nursing. All right, so we did growth hormone, we did ACTH, we did prolactin. Now I'm going to go over number 4, which is TSH. Well, TSH has a boss, and the boss is the president. El Presidente is the hypothalamus regulating everyone. So the hypothalamus has the thyrotropin releasing hormone, which then dictates to the anterior pituitary. What hormone is it? It dictates to the anterior pituitary to release thyroid stimulating hormone. Thyroid stimulating hormone surges through the bloodstream and therefore stimulates the thyroid gland to release thyroxine, which regulates metabolism. Okay. Now, so we went over, circling back. This is the only way you're going to learn. We went over growth hormone. We went over ACTH. We went over prolactin. We went over TSH in the anterior pituitary. We have 2 more because there's 6. So what are the 2 more? I mentioned them earlier, FSH and LH. Well, how do we have the hypothalamus regulating them? Well, the hypothalamus releases what's called gonadotropin releasing hormone, which then triggers the anterior pituitary to release both FSH and LH. What does FSH do? Well, ovaries and testes it'll stimulate ovulation, and in the male, sperm production. LH, it'll stimulate estrogen. In the male, it'll stimulate testosterone. Oh boy, that was everything. So now I have one last thing to mention in this image, and then we carry on and move on to show you this presentation that is found in the National Library of Medicine. The next topic is the posterior pituitary that is kind of integrated with the nervous system directly. All right. And so the hormones are stored in the posterior pituitary, but they're made in the hypothalamus regulating it. And they're stored, like I said, in a posterior pituitary. Now, the posterior pituitary gland, luckily, you only have to remember two: ADH and oxytocin. ADH regulates fluid, and oxytocin, as I said, is going to initiate the first milk letdown. It is also the love potion 99. Why do I call it that? Because it's the hormone that makes people bond. Now, if it's a mother that's about to deliver, it initiates bonding with the offspring, creates that mother offspring bond. It also initiates labor and delivery. So the more oxytocin is released, the more labor and delivery progresses. This is the only, and I repeat, the only hormone that does positive feedback. All the other ones are negative feedback. So oxytocin, the more, as you release it, it stimulates to release even more as the L&D, labor and delivery, progresses. What else can I tell you about oxytocin? Besides labor and delivery, besides bonding with the offspring, besides the first milk letdown, the fourth function is falling in love with the opposite sex or same sex or yourself, or nowadays it's the mirror. I don't know. So my whole point is it initiates that whole attraction with whomever you want to be attracted to. Okay. So that's every single thing that you need to know about all these glands. Now, the mechanism of action you could read through. I'm going to provide this PDF for you. And there's a nice flow chart showing you negative feedback here. So you've got negative feedback that goes to the anterior pituitary. And so what's going to happen is, if we have enough coming from the target gland, let me feed in an example here. Let's say you have enough of the thyroxine, right? You're regulating your metabolism pretty well, okay? And so now what's going to happen is you have negative feedback going to the anterior pituitary to diminish production of TSH, thyroid stimulating hormone. But that thyroxine also in the bloodstream is going to inhibit the hypothalamus from further stimulating the anterior pituitary. Because remember, the hypothalamus releases thyrotropin releasing hormone. Okay, so you have also a short negative feedback loop from the pituitary hormone, meaning the TSH can, if there's a lot of TSH, it's going to inhibit the production or diminish the production of thyrotropin releasing hormone. So that's just one example of negative feedback. And remember, who is the positive feedback? Oxytocin. All right. Now, also what I find very useful here is the fact that this PDF indicates all the hormones, all their hormone function, and all the endocrine glands. It's all here for you. I would say put these on an index card and you will be an expert in the endocrine system. All right, so here it is what I mentioned. Corticotropin releasing hormone from the hypothalamus stimulates adrenocorticotropic hormone, which then stimulates the glucocorticoids to release the cortisol for chronic stress. GnRH, this is the shorthand version of how you write gonadotropin releasing hormone. GnRH is released by the hypothalamus, and it stimulates what? This one is a big one because it stimulates not one hormone in the anti-pituitary gland, but two. It stimulates LH and FSH. LH and FSH. So GnRH is released by the hypothalamus, okay? And it's going to stimulate LH and FSH. Now, I want you to see something. GHRH versus GnRH. I can't tell you how many people get that confused. Do not be that student, okay? So GnRH, if we show you this on a test, is gonadotropin releasing hormone, which stimulates FSH and LH, which then stimulates, of course, as you know, the testes and the ovaries. Now, let's go over thyrotropin releasing hormone. This is all a review because I showed it to you in the image, and now we're reviewing it in the chart format. So, thyrotropin releasing hormone from the hypothalamus is going to stimulate the anterior pituitary to release TSH, thyroid stimulating hormone, which then stimulates the thyroid gland to release T4 or thyroxine, which regulates your metabolism. Then you have GHRH. This is growth hormone releasing hormone. GHRH is going to be a little bit of a smaller loop. All right, not a big loop. It only goes to the anterior pituitary, and the anterior pituitary releases growth hormone. There is no target gland. There's target tissue, but no target gland. So that's the difference. Everybody else has a target gland. All right. All the other anterior pituitary glands, anterior pituitary gland hormones have a target gland that will release a target hormone. But this anterior pituitary hormone, growth hormone, it just goes to target tissue for growth. Okay, so I hope I'm super clear about that. Now, what I didn't mention in that image earlier is that you want to also have a feedback loop to stop. All right, you got to stop. You don't want to grow tissue forever. So to stop growth hormone, we have somatostatin. Where else did we talk about somatostatin? The delta cells in the islets of Langerhans of the pancreas. Yes. Okay. And then least talked about is dopamine. Dopamine is released by the hypothalamus, and it happens to, although it's also the happy hormone, it also happens to inhibit the release of prolactin from the pituitary. All right, now let's go over the ACTH. It's going to stimulate the hormones of the adrenal cortex, meaning the glucocorticoids. LH, as you know, in women, it stimulates the sex hormones such as estrogens in the ovaries, as well as during ovulation. And then in the men, it stimulates testosterone production. FSH is all about the follicle development and ovulation. And in the men, it's all about the sperm production. TSH is obviously going to stimulate thyroxine release from the thyroid gland. Growth hormone is going to promote body growth and development. Prolactin is the one that's only going to be happening in lactating women. Remember, oxytocin is the initial activation of milk ejection, but then to maintain nursing or lactation, that's the prolactin hormone that comes from the anterior pituitary gland. Okay, moving on. Don't forget that ADH is an important hormone that is released by the posterior pituitary gland. The old name for it is vasopressin, so don't let that throw you off. Antidiuretic hormone, ADH. It helps control the body's water and electrolyte levels. The adrenal cortex, as I mentioned, are the glucocorticoids, which is cortisol. It controls your carbohydrate, protein, and lipid metabolism and protects against stress. But if you have chronic stress, you're going to have hyperlipidemia, high proteins in the blood, and hyperglycemia, which is a formula for disaster to create diabetes, plaque formation, atherosclerosis, hypertension, and heart disease. That's why chronic stress kills right here. Okay. Short term, not a problem. But if you continuously do this excess cortisol, it is a big problem. Then remember what I mentioned about the aldosterone. It controls your body's water. So reabsorption of sodium, water follows via osmosis. I want to mention that it's pretty much very similar to ADH, antidiuretic hormone. So there's many ways that we can regulate our fluid, okay? ADH, by the way, is inhibited when someone is drinking a diuretic. So like a diuretic would be a tea or coffee or alcohol. ADH is inhibited, and therefore urine output increases, and that's why we get dehydrated with diuretics. All right, now the testosterone is important in the testes because of stimulates the production of the reproductive organs, male secondary sexual characteristics, sperm production, and anabolic proteins. All right, ovaries, super important because obviously the follicle formation and then the release of the egg once a month, day 14. We also have the other hormone that we don't talk about until we do reproductive system, but it's called progesterone. And progesterone is I like to call it the hormone for pregnancy, P for pregnancy, progesterone, because it preps the body for pregnancy. Why? Because it thickens the uterine lining. It prepares the uterus for pregnancy, as well as the mammary glands for lactation. Next is the thyroid gland. You have the thyroid gland that's going to be the inactive version, triiodothyronine, but the active version of the hormone T4 is called thyroxine, and that is going to control the metabolic processes of the cells. And then, of course, I mentioned, as you recall, if you could remember, calcitonin, which controls calcium metabolism. If the blood levels of calcium are low, then, of course, what do you think happens? Calcitonin is going to be released by the thyroid gland. Calcitonin is going to stimulate the, I mentioned, oh my gosh, high calcitonin. If blood calcium levels are high, not low, it's the other way around. Parathyroid gland, oh my God, I can't believe I make that mistake. So calcitonin, if the levels are high in calcium, then that's what's going to happen. You're going to have high levels of calcium. And so in turn, the calcitonin is going to come to the rescue and take all that calcium from the blood and mobilize it and store it as calcium phosphate. Now, the reverse is the parathyroid gland. All right, it's going to release parathyroid hormone when the blood levels of calcium are low. When the blood levels of calcium are low, now the parathyroid gland releases the parathyroid hormone, and that increases the calcium to break down from bone, and levels of calcium go back up in the blood. Now, the pancreas, don't forget the 3 different types of cells. The beta cells release insulin, the alpha cells release glucagon, and of course, the delta cells release somatostatin, which is not on this list, but that's okay. All right, so I think I beat that to death. All right, so what did we know about posterior pituitary? Posterior pituitary does not produce its own hormones. I wanted to really highlight that. Instead, it stores the 2 hormones, ADH and oxytocin. But of course, these hormones are produced by the neurons in the hypothalamus. Please remember that, because that is huge. Now, alcohol consumption has shown to reduce the levels of GH, growth hormone. Interesting, right? So also, as I mentioned, alcohol can influence the ADH release, right? It inhibits ADH, so you lose more water, and that's why you get dehydrated and get the headache and the dehydration the next day after binging alcohol. Cortisol, as you know, it has to do with all of the deleterious effects of stress. Cortisol levels will shoot up during major surgery, during trauma, severe infections, pain, blood loss, hypoglycemia, and emotional stress. All right, so I think you could read all this on your own. I think I did a good job explaining everything. There's one more image here that I want to go over, and I think I will end this YouTube video right here. These two topics right here, and I think that's about it. Yeah. So these two topics I'm going to go over right here. So this is the same topic. I just want to show you the flow chart and the feedback system, right? So we've got the HPA axis. So we've got, in this example, how the stress occurs and the metabolic effects. And we need to go over this because this is something that we see all the time, and the deleterious disease effects of chronic stress. Then I'll show you the female versus the male. And of course, in here, we're going to look at the metabolism and how we can increase our metabolism. Okay, so here we go. So we have stress, whatever that stress is, chronic stress. We're not talking acute stress, fight or flight. You see a bear in front of your face and you're like, oh, shoot, what do I do? No, this is chronic stress, like for days on end. All right. So you get the picture. You haven't slept in days. You've got final exams. You can relate to that, right? Okay. So the hypothalamus is stimulated. The hypothalamus releases corticotropic releasing hormone, which then stimulates the anti-pituitary to release ACTH, which then stimulates the adrenal cortex to release cortisol and has the metabolic effects of hyperglycemia, hyperlipidemia, amino acids get released in the blood. So all of this causes elevation of blood volume, so blood pressure goes up, and hyperglycemia in a chronic state leads to diabetes. Here we have GnRH, gonadotropin releasing hormone, which stimulates anti-pituitary to release LH and FSH, and we have ovaries. And as you know, LH is going to stimulate estrogen, FSH is going to stimulate progesterone. So again, whether you are a visual learner through just looking at the glands, or if you're a learner that likes to put things in words and chart format and index it on an index card, then that was that way. And then if you like flow charts, well, there's this way to learn. So I just showed you 3 ways to learn the hormones. You can write it out any way you wish when you're studying. Personally, I like flow charts, but some students like to write it down on an index card, and I showed you the chart format. But of course, visually, I went over all the glands so you know where they're at, and I mentioned verbally what's in those glands, like what are the hormones. So whatever way, whatever technique, but you need to know all the hormones, okay? All right, now last but not least, these two here. Let's go over this one. So we have the hypothalamus getting stimulated and releasing thyrotropin, thyrotropin releasing hormone. And then thyrotropin releasing hormone, or TRH, stimulates the anti-pituitary to release thyroid stimulating hormone, or TSH. And then that goes in the blood and reaches the thyroid gland, which then releases T3 and T4. T4 is the active version, which increases metabolism. All right, let's look at the male here. The hypothalamus releases GnRH again, just like in the female. Same thing, LH, FSH, but men are simpler. One button does it all, whereas females have like 3 different hormones. Well, here, you got LH and FSH that men and women have, but the women have testosterone, they have estrogen, they have progesterone. And when we do the menstrual cycle, you're going to learn about a few more in addition to that. So anyway, LH and FSH, as you know, LH stimulates sperm. I'm sorry, LH stimulates testosterone and FSH stimulates sperm production. All right, so alcohol and its deleterious effects, you can read all about it here, how it can inhibit the growth hormone, it can inhibit other issues like your TSH response, and of course ADH. And I don't know if you know this, but it also causes issues with the offspring, you know, fetal alcohol syndrome. And then if you look at dopamine, the blunting effect may result from alcohol's influence on the neurotransmitter dopamine. Dopamine produced in the hypothalamus acts not only as a neurotransmitter, but also as a hormone in that it inhibits the release of both TSH and prolactin from the pituitary. All right, so alcohol has been shown to increase dopaminergic activity and thereby may suppress the TSH response to TRH. So do you see how if you drink a lot, it can also affect your metabolism? So there you have it. I hope that you enjoyed this lesson. It was way longer than I intended to. Can't talk anymore. But I do hope that it was intense, and apparently I do hope that it helped you. Please say something in the inbox. I don't care. I'm going to make this public. Usually this is private link for my students, but maybe there's somebody out there from a school that I don't teach at that could benefit from this review. All right. And make sure you check it out in National Library of Medicine if you want to read it that way. And here's the citation. Don't ask me to pronounce this. Hiller-Sturmhöfel. There you have it. And the title is Endocrine System, an Overview. All right. And the journal is Alcohol, Health, and Research. And there's your link. All right. So anyway, I will talk to you all later. As always, I will continue my learning videos. Bye, everyone.